Hey there, this is Dave Hompes, and in this short video, I am going to talk to you about heartburn and gastroesophageal reflux disease. We're going to have a look at the difference between the two. Now, going back several years, I actually had quite a severe case of heartburn myself. Turned out that my heartburn was being caused by a chronic stomach infection called Helicobacter pylori. And Helicobacter pylori is just one cause of heartburn and gastroesophageal reflux disease. There are literally probably a dozen and a half, if not more, different causes, should I say, of this particular condition. Now, I think most of us have experienced heartburn at some point in our lives. That sensation of feeling a warm burning sensation in the center of the chest. Sometimes it kind of comes up a little bit higher into the lower throat and possibly even feels like it's coming right up into the throat and the mouth in some cases. Now, the difference between heartburn and gastroesophageal reflux disease is quite simply that in the latter, in GERD, G-E-R-D, you end up in a situation where there is a lot of inflammation and damage to the delicate lining of the esophagus. And you may also develop other symptoms along with just the heartburn. So there might be some belching and bloating. There might be some real severe reflux where you feel the stomach contents coming back up into your throat. You might feel bloated. You might have some pain and trapped gas further down the digestive system. There may be some bad breath involved with this as well. Maybe even a little bit of nausea and a whole bunch of kind of a cluster of different symptoms. So gastroesophageal reflux disease is more a cluster of symptoms rather than just heartburn, which is literally just the burning sensation in the chest and the esophageal area. Now, why would we be bothered about heartburn and gastroesophageal reflux disease? Surely everybody gets it at some point, and surely it's just harmless. Well, that may not be the case. A study that was published in 1999 showed that people who have heartburn have roughly an 8 times increased risk of developing esophageal cancer. And an even more worrying statistic from that study was that people who have heartburn, just simple heartburn, for more than 20 years may have an increased risk of developing esophageal cancer by about 44 times. So a 44-fold increase in the risk of developing esophageal cancer just from having a little bit of heartburn day to day for 20 years or more. Now, how many people have heartburn or gastroesophageal reflux disease? Well, the statistics are pretty alarming. According to the UK NHS, National Health Service, 1 in 5 people has heartburn once a week, and 1 in 10 people has heartburn once a day. That's literally every day. Statistics in the USA are not too much different. Approximately 7% of the population experiences heartburn each day. Approximately 14% of the population experiences it each week, and approximately 21% of the population experiences heartburn once a month. That is an awful lot of people. And the biggest problem with heartburn and gastroesophageal reflux disease is that it's assumed that excessive levels of stomach acid are the reason behind the symptoms. And from my research and my clinical experience, I can absolutely, with 100% confidence, inform you that that is not the case. In fact, most of the people who have heartburn and GERD actually have inadequate levels of stomach acid. That's not enough stomach acid. And in future videos and other videos that you can find here on YouTube or on my website, I'm going to explain to you and teach you some of the main reasons for depressed stomach acid and some of the other simple factors in your lifestyle that may be creating problems with heartburn and gastroesophageal reflux disease as well. So I hope this video has been really helpful for you. I hope you've gained a lot from it, and I really look forward to talking with you again next time. My name is Dave Hompes, and I thoroughly look forward to seeing you again next time. Thanks a lot.